Today, I'd like to share my understanding of cracked teeth. Well, I chose this topic not only because it's quite common to see a tooth needing a root canal because of crack, but also because it can be quite tricky to diagnose them in the early stage. And that's when there might be a very small chance just a crown will be enough without the need of a root canal. Patients with cracked teeth in the early stage may share a chief complaint like this. Hey doc, it really is not a problem, but when I chew on certain things like chips, popcorn, I feel this twitch. But that doesn't happen every time, so I just avoid that side sometimes. Again, it's really not bad. If you don't see anything, I can live with it. So we might suspect a cracked tooth from this kind of dental history. Now, obviously, patients will tell us if the symptoms from the left or right side, although there are times they could not distinguish if it's from the upper or lower jaw. As dentists, we might be able to see a crack through direct visual or transillumination. However, most of the time, more than one tooth has a crease line or crack line. So which tooth is it? A few common diagnostic methods may not be as useful in detecting cracked teeth in early stage. For example, there may not be any lesion at all on the radiograph, and the tooth most of the time respond normally to percussion or even pulp tests to cold and hot. Now we all know reproducing symptoms can be very conclusive in diagnosis. And here's a tool I have in every exam pack, this tooth sleuth. It's fairly effective, very inexpensive. I personally prefer the type 1, the white one on the top. And here's how to use it. I place the tooth sleuth at different cusps and then have the patient slowly bite down. After they bite down, I tell them to hold it a little tighter. And then I tell them, when I say open, open quickly. Now open. Patients may not have much discomfort when they bite down on this tooth sleuth, but the pain upon release is a sign we look for. I do need to say here that this tooth sleuth will not be useful in the late stage cracked teeth when the pulp is already necrotic. Now, what kind of teeth prone to have cracks? And what kind of patients prone to have cracks in their teeth? Also, what happens to a cracked tooth after it gets a crown or a root canal? I hope to answer these questions in my future videos. Thanks for watching.